All right. Which of the following best describes the malignant potential of this lesion? And so looking at the answer choices, we're looking basically risk of malignant transformation. So we have to figure out what exactly it is first. We have a 60-year-old woman undergoing screening for colonoscopy. During the procedure, a gastroenterologist identifies a 5 mm sessile polyp in the sigmoid. Histology reveals that the lesion is composed of elongated, straight, and regularly arranged crypts with no cryptological atypia. Which of the following best describes the malignant potential of the lesion? Hold on, my cat is in front of my computer.
No, that's okay.
What's
Sometimes
attention?
the animals always want to answer some questions too. So that's
Yeah, or just prevent you from answering.
exactly,
Okay,
exactly.
so we have a sessile polyp, and let's see. Elongated, straight, and regularly arranged crypts, no cytological atypia. So it looks like it's going to be, we're not seeing a lot of like atypia and like remodeling. So I'm leaning more towards a benign kind of tumor. I'm not really sure exactly what kind it is. Maybe adenoma, so I'd go moderate.
Okay.
But if we had like a gene knockout, maybe we'd have something, but not super sure.
Okay. So I'm gonna work through this with you once again.
Mhm.
This is becoming very histologically specific, right? But
Yeah,
on a test taking standpoint, right? Um, uncertain malignant potential is probably a bad answer, right? Just on a test taking standpoint, right? That just
yeah,
practically means like you don't, I mean, I don't know, and also the question doesn't know, right? So probably not the answer,
yeah,
right? Um, I also don't like absolutes, right? Me personally.
yeah,
So
I don't
no
either.
risk,
I was kind of thinking that.
yeah, no risk of
I was like,
malignant
hardly
transformation.
anything is no risk.
Yep, no risk for malignant transformation. Not great in my mind, right? Me personally, on a test taking standpoint, right? Going back to, I keep saying test taking standpoint, right? How I would approach this is either low or high risk. Me
Okay.
personally. Moderate is kind of this in between thing, and it's very hard to test moderate risk
Yeah, that's
because
true.
it's right in the middle. So if I were to guess, right, me personally, I would guess low risk, right? But
Yeah.
this is just purely based off of test taking, right? Could be completely freaking wrong, right? But not always about being right or wrong. It's about kind of learning from it. So which one do you want to go with?
I think that's a good point that like it makes sense that they would be testing something that's easier to describe. So I'm okay with switching to low risk.
Okay, perfect. Let's see. We could be both wrong here.
we'll,
All
we'll
right.
find out. Nope, we were
So
right.
cool. So low risk, right? So that's me personally, that's how I go through questions. I just wanted to kind of give you a train of thought, right? It's not always correct, right? But I'm
Yeah.
looking at it like this, right? And I didn't completely talk to you through my logic of why I picked low instead of high, right? Because
Mhm.
I mean, I think you already kind of saw that, right? There's no cytologic atypia, right? I'm not sure exactly kind of what kind of, they call it a sessile polyp, right? But
Mhm.
elongated, straight, and regular range crypts, that means that the histology is pretty normal. You know what I mean? So it's
Yeah.
organized, right? So in my mind, it's benign, right? It doesn't look
Yeah.
nasty because if they were to describe it as something that is, irregular, right? Cytology is, you can't tell the architecture, right? You have high
Mhm.
atypia, you have high mitotic figures, meaning it's dividing fast, right? Those are all things that you're like, oh man, that is like cancer, right?
Yeah.
But yeah, that's, in my mind, that's how I work through it. But let's kind of read the
No, I mean that
explanation.
makes sense to me because I was reading it and being like, I don't know what this is.
So sometimes, right, you have to, I know this, this is kind of a test taking thing, right? But picking martyr is kind of like, in my mind, how I think about it, right, is how can the test taker like test you and make you put something right smack in the middle? You know what I mean? That's
Yeah, no,
extraordinarily
that's
hard.
fair.
yeah, it's hard as a test taker to write something like that, because how would you write that, right? You would have to think, right? It would have to be something so like pathology specific, like, oh yeah, there's five, mitotic figures in the power field, and then maybe 10 is when it's high risk. But like, how would we be responsible for that? You know what I'm trying to say?
No,
So
that makes sense. I struggle with the test taking strategies and trying to think like somebody who writes a test.
sure, sure. And lucky for you, I wrote a lot of these questions. So I mean,
Yeah.
there's too many for me to remember how many, like, as you can tell, like I'm not always correct because I wrote this like the 18,000 questions a long time ago. But yeah, so this is a hyperplastic polyps, right? So most common colorectal polyps and are generally considered to have a low risk of malignant transformation. So and kind of going back to kind of your diagnosis, if you thought it was adenomatous, right? Just remember adenomatous is on kind of that scale of malignant transformation. So that actually has a higher risk.
Yeah.
So
Okay.
perfect.